October is Breast Cancer Awareness Month. What you may not know is that 7% of all breast cancer cases are in women younger than 40. All new at 6, KVUE'S Jim Bergamo has one young woman's story. Jim, she was actually fighting breast cancer while planning to have a family. It's a remarkable story.
It really isn't a story that plays out quite frequently. Doctors freezing embryos has been done for decades, but the technology that allows just the woman's eggs to be frozen is relatively new. And now that fertility treatment is giving hope to women who have to battle cancer before starting a family.
We told all the parents separately.
6 years ago, Brianna Wood of South Austin was 27 years old.
I was really healthy. I just ran a marathon.
Wood says she had no family history of breast cancer, but a doctor informed her she had dense breast tissue. So when she and her husband decided to start a family, she had a mammogram just to be on the safe side.
We were stunned with the news. I don't think I can describe for you what that was like for me and for my family.
The mammogram revealed a golf ball-sized tumor that required chemotherapy.
I read that fertility would likely be affected, and that was sort of equally devastating.
That's because the chemotherapeutic agents target hormone-producing cells, and the ovaries produce hormones.
So for women, all the eggs we were ever going to have, we were born with. We don't get to make new eggs after our illness is over.
While doctors have been freezing embryos, the sperm and eggs together, for decades, it's only been within the last 10 years or so that new technology has allowed them to freeze just the eggs. Wood's oncologist recommended she do just that.
And she had the foresight to kind of envision my life post-cancer. And that was really hopeful for me.
Wood's subsequent chemotherapy, radiation, and surgery did reduce her fertility to almost nothing.
So it was clear that her opportunity to be pregnant was going to result from those embryos that they had frozen in 2007.
Wood, now cancer-free for 5 years, is also 12 weeks pregnant.
And we're kind of shocked that we're pregnant, so it's the opposite kind of shock that we experienced 5 years ago.
Wood says her advice to women in her situation, just talk to your doctors about your options. She says she's learned there's lots of ways to have a family.
It is emotional. It's been a long journey, and we're really grateful to be where we are today.
Now, Dr. Hansard says it usually only takes 2 or 3 weeks to gather enough eggs from the patient, and Wood says while she still doesn't know the sex of her baby, ultrasounds have allowed her to see the heart, see and hear its heart beating. She and her husband are thrilled. And Terry, by the way, I got to mention this, it's the first grandchild for both families, so you know they're thrilled.
Such an exciting time for that whole family. We wish her well, and hopefully we can follow up with her. Jim, thank you.
Thank you.